couldn't be a better community to do the kind of research that I think makes a difference in the lives of children. And it's also an honor to be here with all of you representing the county, because I think you're in the business of promoting resilience, and I'll come back to that. The science that Megan presented is both scary and exciting. It's scary because we're beginning to delineate in such incredible detail at multiple levels, from molecules all the way up to behavior and social life, what goes wrong in brain development or a person's life when they have experienced too much adversity without enough support. But it's exciting because the same research is also revealing how incredibly adaptive the human brain and development truly are. And fortunately, the brain is not left to its own devices to develop. There's a lot of adaptive and protective systems that envelop brain development throughout a person's lifespan. So in my brief time, I want to begin with just talking about resilience, and I'm going to move forward and talk about the ways that you might think about the county's business of promoting resilience in children and families that you serve. Resilience is all around us. I'm sure that every one of you has experienced many people in your own life who you would identify as resilient. This is one of my favorite resilient people, Joe White, who grew up on the west bank of the Mississippi here in the Twin Cities in the old Pillsbury neighborhood, and had at that time to contend with the burdens of poverty and racism. And yet he had a wonderful family, grew up to become a wonderful and competent human being, and a professor at the University of California, Irvine, now retired. And he has received many honors in the Twin Cities, ranging from the highest honor given by De La Salle High School, where he graduated, to the highest honor given by the University of Minnesota. I also, in my work with homeless, refugee, and disadvantaged children in the Twin Cities, in this county, and many other places around the world as well, encounter remarkably successful parents and children every day. You can visit any shelter in the Twin Cities and directly observe individual children and parents who are striking to you and how well they're contending with quite an incredible burden of stressors in day-to-day life. How do they do it? I also have experienced child soldiers recovering from war zones. We have many, many refugees from war zones, as you all know, in the Twin Cities, and many of them reside in Hennepin County, and they also convey an extraordinary story of resilience. I want to tell you a little bit about one individual case. This child was affected by not by Hennepin County, but by Los Angeles County. And it gives you a sense of how counties interact with a child's development. I'm going to call this child Sarah. That's not a real name, and this case study has been published. But I met Sarah when I was part of a clinical team doing my internship at UCLA, and she was 2.5 years old when I met her. And what you're looking at here on this chart is her growth curve. This is a typical growth chart of a child. The top line is height, the bottom line is weight. And everything looks like it's going well for this child during the first year. And then her development went off track, and she's basically stopped growing sometime between 12 and 15 months of age. When I met her, everybody was incredibly concerned. Her behavior was strange, she wasn't growing, and she was in the custody of the county. And they were asking the question of this team at UCLA, what's going on with this child? What can we do? They were hospitalizing her with the question, a profound question, should we place her in some sort of an institution, or should we place her for adoption? That's a big question in a child's life. And so this team set up to try to figure out what was going on with this child, what explained that sudden turn of developmental direction and what could be done about it. And we discovered some important facts about her history. First of all, she was born into the county system in a sense, because she was born to a homeless mother who was on the street till she went into labor. went to a hospital, the child was born, and then a day later this parent abandoned the child and she was placed in her first foster care home, and everything went well. It was a really good fit for this little girl, and she flourished, and the county kept very, like many counties do, kept very good track of how she was doing, sent her to the pediatrician and so forth. So we had wonderful records of her development to look at. Well, then when she was about 12 months old, her foster father, who she's very attached to, became critically ill and abruptly died. And the foster mother had a terrible reaction to the loss of her husband and couldn't deal with things after that. And when this child was 15 months old, she called up the welfare department and said, "I'm overwhelmed, I can't take care of the kids in my care anymore, and I need you to come get them today." So this child was picked up by a total stranger, taken to a new foster home, and left there, and she went into a developmental tailspin from which she had not recovered when she was hospitalized. And the question we then had to ask, well, was there something different about this child? Or was this basically an expectable reaction to a calamity in a young child's life? Every possible test was done to ensure that there was nothing physically wrong with this child. And we concluded, this team, after an extensive evaluation, that she needed a new home that was well matched to her needs. And we were told by a social worker who was one of those dynamos, of which we have many in Hennepin County. She said, "You write me a prescription for a family and I'll fill that prescription," because she was taken with this little child. So we wrote the prescription, and I'll let you think about, while I'm talking, what you would have put on your prescription. You can ask me that in the question period later, what we put on our prescription. But this social worker filled the prescription with a wonderful family, and this was, and then this was her response. She made a spectacular recovery across the board as soon as she was placed and adopted into a well-matching family, and she has grown up into a lovely young person. And I'll come back to Sarah in a minute. I want to talk a little bit more about the phenomenon of resilience, what we've been learning. I don't have much time, so I can't go into a lot of detail, but I've written a lot about this, and you can read all about it in as much detail as you wish. And then I want to talk specifically about a resilience framework for action, because you're all in an active business of promoting resilience. When I define resilience now, this is kind of a modern definition, I define it as the capacity of a system, any kind of a system. I'm often thinking about an individual child, but you might be thinking about a family system, and some of you might even be thinking about the Hennepin County system as a whole. But the capacity of a system to withstand or recover from significant disturbances of the kind that Megan talked about, toxic stress, overwhelming adversity, that could threaten adaptive function or development or the life of this system. But again, we can talk about many kinds of systems, from the level of a molecule up to the level of global climate change. Resilience is about how systems withstand and recover from serious threats. And all of us are hoping that our planet will be resilient in the face of the disturbances of climate change. And I think we're still trying to recover as a nation from the disturbances of the economic crisis that began around 2007. Certainly that has percolated through many of the county systems that I've observed. There are two essential ingredients when you think about resilience. One is the presence of risk of some kind. There has to be some kind of adversity or risk that's present, and there also has to be observable evidence of good functioning, recovery, good adaptation, positive development. When both those are present, we talk about resilience. And I want to come back to a cumulative risk chart. This is very similar to the one that Megan showed you earlier. And people who study resilience quickly figured out, as all of you have, I'm sure, who work with families and children in the county, risk factors often pile up in people's lives. This is actual data on risk factors in the lives of children from the People Serving People shelter a number of years ago. And we did a study and counted up very common risk factors that you can see listed there, like a mother doesn't have a high school education, it's a single-parent household, the child has a history of foster care, maltreatment, and so forth. These are typical risk factors, and you see a lot of this kind of risk in the families that stay in shelters in the county. And what you can see here is the higher the risk level gets, the more of these risk factors that are present in the life of a child, the more problems they show on this measure of behavioral problems, disruptive aggressive behavior. This is the child behavior checklist. 50 is the average level in the general population. And so as you're getting up there at 4, 5, and 6 risk factors, you're up in the clinical range where you really would be worried about how these kids are doing. They would be referred for some sort of intervention or treatment. However, the other thing you can observe when you look at families and children is that, as Megan was saying, that's the average level of problems. But those white dots that I've put on the chart represent individual children who are doing just fine. They have 4 or 5. They're in that group of people who have 4 or 5 or 6 risk factors, but they're doing surprisingly well. And my curiosity as someone who's interested in resilience is, how are they doing it? What makes a difference? And as in the county, when I look at that kind of data, I want to know, well, what's going well? How is it working so well for that child? And what could we learn if we understood that sort of resilience about how to help more children where it isn't naturally occurring? Some of the children that do well in those high-risk categories have in fact had quite a bit of intervention along the way from various county systems, or their parents have, and it's worked very well. What works? Which kinds of interventions have been effective in helping children do well like that? Here's another risk curve from some of our recent work with the Minneapolis Public School administrative data. And what you're looking at here is longitudinal data, all the data from testing in the Minneapolis Public Schools. They used the same test from 3rd to 8th grade, and we compiled this longitudinally. And what you're looking at here is the achievement gap presented in test score data. This is a reading test. This black line is the national average on this test. The purple line at the top is the more advantaged kids in the school district who've never been identified as needing free or reduced fee lunch or homeless in this whole time, and they're doing great, way above average. And then you have these two groups of children. The green line is children on free and reduced, mostly free, and some reduced fee lunch. They're way below the national average. And even lower still are children who have been identified as homeless or highly mobile at any point during this time. This is the achievement gap laid out over time, and you'll notice that it doesn't improve over time either. There's no improvement, the gap remains. But I want to talk about resilience, and this doesn't portray resilience, it portrays risk. And so how do I get to resilience from here? I show you that bottom group of people as individuals, their individual achievement, which is right here. And this yellow line is their average again. This is the national average. But what you're looking at is incredible variation. Some of the children do very, very poorly all the way along, and they pull the average down. But there are other children that have been identified as homeless, highly mobile, and indeed other children that are living in poverty and qualified for free lunch that are doing very, very well across the board academically. In fact, it's close to 45% of children in the category homeless, highly mobile, which is a large category. 14% of the kids in the Minneapolis public schools over time fall into that category. There's a lot of variability. How do we explain these children that are doing so much better than other children and often have encountered many of the same risk factors? What makes the difference? Well, in our research in the Minneapolis School District, we were able to figure out from administrative data that children do better when they attend school attendance is good. They also, we can tell from their early reading scores that children who are reading well in first grade do much better later on in achievement. Getting off to a good start with reading in first grade is an important protective factor, particularly for high-risk children. We also, in our studies of children in shelter, have looked at children and studied their families in more detail to learn about data that schools can't collect. And we've observed great parenting quality is an important predictor of school success, and so is cognitive self-regulation skills, some of those executive functions that use this part of the brain that Megan was talking about. When we measure those skills while kids are in shelter, we can predict how well they're going to do in school. And one point I wanted to add here is that there's an effort afoot to try to integrate some of the county data with some of the district data. And if we could do that in a careful, de-identified way, we could do some interesting analyses to learn even more about what of the county systems work to promote good academic achievement in school and so forth. There are many different patterns of resilience. These are 3 classic patterns, and all of these patterns are associated with high risk or adversity. Pattern A is that there's a group of people out there in the world, you may know some, who hold a steady course of good functioning. They grow up very steadily and well despite a lot of adversity. There's another group, pattern B, that like little Sarah, who are doing fine and then something terrible happens and their development goes off track, and then when we get better conditions for them, they recover. So that's pattern B. And then there's another pattern C, where a child gets off to a very difficult start, perhaps because their family's unable to care for them, perhaps because they're in a neglectful sort of orphanage somewhere in the world, and then they are adopted into a very favorable environment, or the county intervenes and tries to help the family, and then you see resilience as they begin to recover. What have we learned about what makes a difference and how to promote resilience? First, we've learned that dose matters. How much risk and adversity you face matters, and you have to keep that in mind. Timing matters. What you've experienced when. Little Sarah was hit at a very difficult time with the loss of her caregivers. The way things pile up also matters. We've learned that the children, both infants that Megan was highlighting and older children and indeed adults, the people who make it through difficult times have more resources and protective influences. It doesn't look mysterious when you look closely at their lives. And we've also learned that resilience doesn't require something rare or special. I call this the short list. This is really summarizing the resilience literature. If you kind of pull out the punchline from all the world literature from very different kinds of adversities, these are the protective factors that appear to make the biggest difference over and over again in many different kinds of situations and studies. And it won't surprise you to see what is at the top of the list. For children, having positive relationships with caregivers and other positive adults is at the top of the list. But having a brain in good working order that's learning and capable, and as children get older, having hope and being motivated, there's a lot of protective factors out there we could talk about. And let me just move on and pose the question a little differently. What does this short list mean for us as we think about resilience? I think it means that a lot of the resilience we see in children the world over is related to some pretty basic protective systems. And these are ones that you are familiar with that make a difference in the lives of children. And that those adaptive capabilities aren't just in the child. Certainly they're not just in an infant who's left on their own. They're, the capacity for resilience is spread out through different systems. It's especially in the parent and the family, but it's also in the many other systems that families are connected to. Their friends, their neighbors, their churches, their cultural groups, and many, in some cases, for the families you serve, the county systems that they're connected to. And this is just a picture of that kind of interconnectedness. And I often study the child or the child in the family. But children and families are embedded and connected to many other systems. And you can go all the way up to our national policy if you wish to. And the blue zone here is where you would think about the county system and how it may interact with children. But if you take the county system and think about the ways in which you touch the lives of families and children, the activities of the county extend all the way down to individual children, and you also connect with state and national policies as well. I'm not going to talk about these systems, but I've delineated them so that you have them in your handouts that will, if they haven't already been posted online for you. These are the systems that are implicated by that short list. Some of them are in the individual or in the relationships that the individual has. And I want to underscore that families really matter, and a lot for children when you're trying to promote resilience and thinking from a county perspective. A lot of the investment you make, I suspect already, is connected in some way with family. Families have multiple roles in promoting resilience, and as many a welfare system has discovered across the world, it is very difficult to duplicate or replace all of the functions of an effective family. It's one of the dilemmas that you have in county systems. How do you support and improve the quality of family functioning in the ways that promote resilience in children? Because if you try to replicate that outside of a family, it's extremely difficult. But there are protective factors at other levels. Some are in the person, like their immune system. Some are in their culture and in their religious affiliations. And some of them are in the emergency response systems and other support systems that we have built into our communities to try to help out in emergencies. Emergency response, crisis nursery. These are all the ways in which local communities, counties, and those who try to help promote healthy development and positive development in children have organized themselves to try to support development and family life. In my view, and I think the literature is overwhelming in supporting this, the greatest dangers for children are when these basic protective systems aren't working for some reason. They may, in a disaster, they may have been destroyed, the parent may have been killed, or the parent may be impaired by their own mental health or substance use issues. You can damage a child if a child is mistreated or starved so that their brain doesn't get the nurturance it needs or the stimulation. That's very dangerous for children. But if we can nurture, protect, and restore the primary fundamental systems for human development, we can promote resilience, and we can build the capacity for resilience. There's a lot of new horizons in the study of resilience, and Megan is giving you some hints. Just as she was talking about toxic stress in terms of neurobiology, there is an emerging neurobiology on resilience as well. How do these biological systems work to promote resilience? And there's a whole new science of how can we invest strategically in what we call prevention economics. However, I don't have time to talk about all that. I just want to let you know. Science keeps growing. What I want to talk about is what is this framework for resilience that we can apply now. We cannot wait, children cannot wait for us to learn everything there is to know about the neurobiology of resilience and so forth. We have to, and the county has to act now when the clients come through the door or somebody's in trouble now. So how can you frame what you do from a resilience point of view that's congruent with what we've learned? We certainly, the evidence looks like we can cultivate resilience, and that we can promote positive development as a strategy for avoiding problems, and we can facilitate resilience if we're strategic about what we do. And this is a resilience framework for action, and I'm just going to touch on each of these a little bit and then see what questions you have. we can frame positive goals, and I can't overstate this. It is extremely important for systems, organizations, as well as families, teachers, and everybody else to think about your goals in terms of positive outcomes, positive development. What are you trying to achieve from a positive point of view? And I'll give you a few examples of that. You have to have positive models of what you're doing. That doesn't mean you ignore risk, but it does mean that you include protective factors and good outcomes. We need to measure the good as well as the bad in everything we do. And we need to use a few strategies, different strategies that have been implicated in this research. I won't say too much about framing positive objectives, except to say that most of what you do or I do when we're intervening in people's lives or when we're raising our own children to try to promote positive outcomes, if we have positive goals in mind, we align our resources and ingenuity in that direction. And most parents I know, whether they're living in a shelter or next door to me, they are motivated for the positive development and school success of their children. They are much less motivated when you tell people, we're going to try to reduce the risk of your child becoming a delinquent, pregnant 13-year-old. That's just not motivating. But when you talk to parents about children growing up to be successful and getting them off to a good start in school, they're on board. I have hardly met any parents ever, anywhere, that are on board with that. And it's much more appealing. We have phenomenal participation from parents in shelters because they're really motivated for their children to succeed in school and in life. You have to think about positive outcomes, protective factors, and positive resources, in addition to problems, vulnerabilities, and risk factors. I'll just leave it at that. We have to measure the positive, and this isn't just measuring the positive in children and families. We have to measure the positive in our county, too. How is the county doing well? What are the measures, what are the positive indicators that we're doing well or that a particular system within the county is doing well? And there are three basic strategies implicated by a resilience framework for what you might do. One is to reduce risk. If you're trying to promote positive outcomes and positive change, you can't ignore risk. You need to reduce risk exposure, adversity, trauma, and toxic stress. And I'll give you a few examples of that. But you also can build resources and assets into a child's life, or you can try to restore and mobilize the really powerful fundamental adaptive systems like a wonderful family or parent for a child. Here's a few examples of risk-focused strategies. And these are probably very familiar to you because counties are very engaged in these kind of risk reduction strategies, and they're extremely important. I think we could do much more than we do along the line of some of these, and you can probably think of some more. One of the most cost-effective achievements in industrialized countries with health systems is preventing low birth weight and premature birth. This is a great investment. It's very expensive to take care of a baby that's born 3 months early. The United States is surprisingly lagging behind other countries, and I don't know county to county, but we could do better in preventing problems at birth. We also need to reduce the stress of pregnant women. This is coming straight out of the toxic stress literature. There's fabulous evidence indicating that stress, particularly trauma exposure during pregnancy, has long-term effects on the developing child, even going on to the next generation. And there's fascinating data on that coming out of 9/11 and other disaster types of literature. We also need to screen and treat depression in mothers. That already came up today. That's a very important stressor for children, and that's something we can do something about. And the last one there is close to my heart. We can do better preventing repeated homelessness. I can't tell you how many families I see in shelters now that are having multiple bouts of homelessness, and it's very, very difficult for the mother, father, and children involved. We also can add assets to a child or parent's life. When you add resources, that also promotes resilience, particularly in high-risk families. And again, I've thrown up a number of examples that I think the county is often involved in. And one of the ones I just wanted to highlight here is to provide stable housing and case managers. One of the things that's very striking among high-risk families is how much disruption there is in their lives and how much change and chaos. This is especially true when you see families coming into shelter systems. They're dealing with so much change, and their children are dealing with change. And some of the most effective programs for homeless kids stabilize the lives of the family. They stabilize the child in school or preschool. They stabilize the family and housing. They stabilize the people that the family interacts with to provide services. I would also place on this asset-focused list the scholarships, whether it's for preschoolers or for the University of Minnesota. That's putting positives into the lives of children. But then there's a list of these sort of fundamental adaptive systems and what we could do about that. Any efforts we make to foster a close and positive and secure attachment bond between a young child and family caregivers is an example of this. When we put mentors into a child's life, when we make efforts to ensure that a child is engaged, not just attending school, but engaged and motivated about school, when we provide opportunities for kids to feel successful so they get that sense of, I can be somebody, I can do something, and develop their talents. These are all mobilizing some of the most powerful protective systems in human nature and development. But there's multiple ways to do it, and at the county level, you're intervening. There are many different ways that you are touching the lives of children. And many of you, there was probably a very long list of all the ways in which people in this room are trying to reduce risk, add assets, or mobilize these powerful adaptive systems for child development. And they are interrelated. One of the challenges I think for you to consider is, could we do a better job by coordinating what we do? I know there have been some efforts to do that, and I'm really proud to be on the board of the Northside Achievement Zone, because I think they're a very nice example of trying to coordinate and wrap all of the different kinds of supports around a family to provide what a child needs to develop well. Collaboration is involved. I'm very pleased to be part of the collaboration of the Hennepin County and the University of Minnesota, and also those two with the school districts around here and the many other organizations that are trying to work together to promote resilience in children. No one system, no one person has all of the know-how and talent and resources to make this happen. A few more comments and then I'll stop because I see my time is running out here. The interventions that work in the resilience literature are both developmentally informed. They have an understanding of human development, and they're also developmentally timed. They're culturally appropriate. I think I'm preaching to the choir here. Everybody here knows all this stuff. And they build on strength. They mobilize, they build on the positive, and they mobilize these powerful adaptive systems in human lives. And there's windows of opportunity for promoting resilience. Megan gave us some hints in her talk about this. Certainly there's some prenatal windows of opportunities for investment in long-term resilience. We want that little brain to get off to a low-stress, productive start. But there are other windows, and one example is in the preschool years. We're focusing our research to develop better executive function skills on preschool because that is a window of opportunity for changing executive function skills. The brain is extremely responsive to intervention in that window. That's why we have preschools when we do. And we can promote executive function skills during that window. And we're working hard, and you can ask me more about this if you would like to to work carefully with shelter providers, school districts, and expert teachers to build a new curriculum, parent education materials, and coaching for children that will help them develop these important executive function skills before they get to kindergarten. And that's what you need to succeed. And when I see too many children enter kindergarten without these essential cognitive skills that they need to flourish and learn in those very early years. Here's one of the little graduates from our program who gave permission for her picture, her and her mom. Resilience doesn't require anything rare or special. I'll leave you with that message. This is my favorite message called Ordinary Magic. What we need to do doesn't require anything unusual. We're talking about building resources and adaptive systems that are very fundamental. But if we don't make sure that these basic systems are in place for children and their families, then development is profoundly threatened. So that gives us our list of priorities. No child is invulnerable. The resilience of children depends on the adults around them in systems and in individual families, and it depends on those adults before the child is even born. But there are many roads to resilience, and I'll stop there. Thank you.